Hi, I'm Dr. Julia Overstreet. I've been in practice about 35 years, and one of the things I've learned is sometimes you need to find a common sense and traditional padding or something to relieve pressure, relieve the possibility of wounds or infections, and that's what we're going to talk about today. There are some wonderful pads on the market for different types of toe deformities, bunions, that sort of thing. So let's look at those. What can cause toe deformities? Here's a big list. We get asked this all the time. They want to know, what is it? And it can be any of these things. And by the way, the first one, motor neuropathy, is most commonly now found with diabetes. We know about sensory neuropathy, but motor neuropathy comes along with that. And the motor neuropathy, as the name implies, excuse me, affects the pulling on the muscles, and therefore the toes can get pulled into different positions. But all of these here, gait disturbance, plantar plate disturbance, that's the anatomy on the bottom of the forefoot. Now that can have injuries or other abnormalities that also can cause the toes to curve. Shoe fit issues. Obviously, if the shoe is too short, that's going to cause problem. If the shoe is too big, it's going to cause problem because the foot kind of has to hold on to it so you don't fall over. Trauma and injury, genetics, neuromas, tumors, masses, it can be any of these. And that's what I know in your clinics you look at, is to kind of determine what the cause of this is and therefore what the treatments can be. So we're talking about interspace, or otherwise known as interdigital lesions. The fancy, or the not so fancy name for that, is kissing corns. Okay, and here's a little more dramatic picture of it. Whether it hurts or not, this is pre-ulcerative. It can get infected really easily, and if they're not neuropathic, it hurts a lot. Here's another couple of x-rays. You can see right here, this little exostosis on this bone is because, I know it's not in this x-ray, but in real life, that toe curl, the fifth toe curls under the fourth toe a little bit more because of shoe wear, and that little exostosis rubs there. Kind of the same thing. This is a different x-ray, kind of the same thing. So, same thing there. That's really common. Come on. And that's the fifth toe. That's what it is. And if you were to put, I mean, I've done this many times, put a lead BB on that or whatever marker, and when you're taking an x-ray, you would see that this coincides with this exostosis. Minor surgery can be a permanent correction for this. What they would do is just numb up the fifth toe, or whichever toe it is, where the anomaly is, make a little incision and just take off that little spur. That's all there is to it. It's like a half-inch incision. You can do it in the office. I've done it lots of times. And it's safer to do that than to let the person walk around with this infection brewing all the time. So I know that sometimes there's resistance to doing this very minor procedure because the person's older or the person's they have diabetes and other problems, but that's exactly when you need to do something like this. So there is a permanent correction for it, but it is surgical. There you go. That's where the incision would be. But let's move on to what we're going to do either before that happens or instead, if they truly aren't a surgical candidate or it's just decided that that's not the way to go. Lots of different kinds of interspace protection. We have this gel material that goes in between, a foam, different densities of foam that can go in there. Here's lamb's wool. You just kind of move, I just kind of make it a U shape and put it, you have to put it between two interspaces just to hold it in place. So that this doesn't imply that there's a sore in both of these interspaces. The sore actually was on the medial side of this fourth toe, but you have to hold that on there somehow. So these are little, I call them toe sleeves, and they have silicone pads on the inside. And when you put it on, it looks like that. So you would move this around to where that sore was on the pictures of the interdigital sores we saw before. This is a silicone toe sleeve, and It protects both the distal tip and the sides, because you can certainly have, and we'll look at some, you certainly have lesions in all different places on the toes. So different ways. Now, having said that, they have to be able to reach them, or a caregiver reach them. If it's a 90-something-year-old woman with severe arthritis, she can't reach down, and she doesn't have a caregiver, you'd have to work with whoever is taking care of her to work on this. So, so please do be aware of that. You have to be realistic about it. These are phenomenal pads, but they have to be something the patient can and will use. Here's another type. This is one of those toe socks that's kind of inside out. It has a bigger gel pad there than the one you saw in the previous one. This is a patient I actually just saw a couple of weeks ago. She has a lot of pain right here on the distal. It's an unusual place, granted. It's on the distal interphalangeal joint. You can see it here. That's an unusual place for it, but this toe pulls up, so this spot rubs on the hallux interphalangeal joint. And that's real painful for her. We've tried a number of different things, and this one is actually working. You can kind of see it in different places here, and it has a nice gap. It does, but these little wings on each side, there's wings on each side of this, hold it in place really well, because this one works well on the lesser toes, but because they don't get so much movement, but the great toe gets some movement. So I like this one that kind of sits there like a saddle and kind of stays where it is. Those are awesome. So hammer toes themselves, as we said, there are many reasons for it, but you must choose a device that works in each of the two situations. Hammer toes can be one of two general types, reducible or fixed. So reducible means that the toes can be straightened out, okay? Fixed means they're frozen like that. You can't straighten them out. So it makes a huge difference what type of pad you're going to put on them. It also makes a difference, for instance, on this one, you can see where the tip of all of these toes, or at least those three, are getting just pounded with every step, and we're going to look at that in a second. Also, when they're like that, the dorsal aspect, the raised aspect, is going to hit the shoe more, which of course can be painful and can create lesions at that point. But deciding on which pad or which device, can you reduce them, straighten them out, or are they frozen like that? Really important to know. So this one, for instance, and I'll show you the pad by itself in a minute, it's a nice cushiony pad that goes under the ball of the foot. It doesn't go all the way back, it's just under the ball of the foot. And it has elastic loops, and there are different versions of it with 1 loop, 2 loops, 3 loops, depending on the situation. On this one, I think I would use all 3. And if it's reducible, it will hold them down, and it really helps. It prevents the pressure from both areas. But if they're already frozen in that, you can see that type of pad wouldn't help. So that's what I'm talking about. This is a perfect pad when they can straighten their toes out. Here's that distal tip problem I was talking about, where they, in this case, this person only has the distal joints frozen, not the proximal joints. That's technically called a hammer toe, a mallet toe. And it's frozen like that. So we can't use anything in terms of padding to straighten that out. So it is just that distal interphalangeal joint that's frozen, but it's frozen. So we're going to have to do something to take this pressure off so it doesn't become this. Very, very common. So this is an age-old type of pad that now has a new look to it, new materials. It's called either a Buttress pad or a crest pad, and its whole purpose in life is to relieve distal pressure on the tips of the toe. That's it. It doesn't do anything else. It doesn't stop on the top. It doesn't, nothing else. But it works incredibly well on this. I have used these versions of these for my whole career. And when people aren't neuropathic, they come in begging for them if they can't find any. This is a very successful pad. It comes in different versions. This is sort of a felt version. This is that silicone version. suede or felt, sorry, suede or felt. And it also comes in either 1 loop or 3 loops. The person has to be able to get this on. This isn't the easiest to get on. And they have to be able to take it off too, because it's not good for the skin health if they leave it on for a week at a time. So be sure to tell them that too. It kind of snuggles down here under, it's called the sulcus, and you know that. This is called the sulcus. And when you don't have contracted digits or hammer toes, you see on the bottom all the toe shafts. But when you have contracted digits, just like these pictures, you really don't see the shafts of the toe. So the sulcus is under there, even though in these pictures you don't see it so much. That one you see a little easier. So these things snuggle up in there. It doesn't hurt. There's plenty of room for it, although all of these things come in small, medium, and large. And there's one that is bilateral. Most of them come either right or left foot, for the right or left foot. So I tell the patients the big part of it goes toward the big toe. So this one would only be for whichever foot this is. It wouldn't be the left foot. Sorry, is that the left foot? Anyway, you wouldn't put it on the other one. See the point? This, because the bigger part of the sulcus is in that first interspace area. So that goes under there and just lifts it up enough that you're no longer hitting on the distal tip anymore. Not so much that it takes up room in the shoe. I've never seen any secondary lesions. I've never seen any shoe fit issues from this. It doesn't do that because there is a gap up there, the sulcus, where that can fit. Few little details on this one though, particularly on this. So this elastic band is movable. So you can see here is a little, it's fixed, glued on that side, and it's adjustable on that side. It's not glued. What people can do, unfortunately, is pull it too tight. So here's your tip of the day. If this is the kind that they're going to wear with the elastic band on it, have them bring it in, put it, excuse me, have them put it on. You get it the way you want it, where there's a little bit of space. It's not tight. It doesn't have to be tight. It's held under there because the toes are holding it under there. So leave a little bit of looseness in that, and then gently take it off their foot, turn it upside down, and super glue that second tab down, this one right here. Super glue that down. Now it can't pull in and out, and they're not going to pull it too tight. Please do that, because I've seen some terrible things where they pull it too tight and cause some skin damage. I haven't seen anybody lose toes or anything, but it causes skin damage. So it's a really easy thing to do. Have some super glue. They appreciate it. And then it's elastic. It'll still go on and off just fine. So you fit it the way you want with a little extra looseness to it, and then you glue that edge down. I love that. Now, that's not a problem with the silicone, with the visco gel. So you see, we've looked at those. See, this is the visco gel form of the Buttress pad. And don't do that, what they're doing in this picture, because it will snap. Okay, it's not like an elastic band. These that are actually elastic, you can do that too. Don't do that, it will snap. Eventually, it's a really good product. It's durable, don't get me wrong, but if you're sitting there doing like that, that's not gonna be good for the product. Here are those toe sleeves I talked about. This version has, it's closed at the end like a sock, and the entire inside is coated with that gel. It's not just one spot. Remember, we saw that when we were looking at an interspace lesion, and the silicone was just right there. But on this, it can help problems anywhere on the toe, including the distal tip, because the entire inside is lined with the gel, the visco gel. So a new one to what we're talking about, and it's new to me, I've only been using it a short while, is called the toe crutch. And it's designed to, again, the toe has to be reducible. It has to be able to flatten out. But if it does, instead of that pad we saw on the first, where we had the loops that went over 3 of them and the pad that was underneath, you don't have to do that. Although that's fine. You can do this, where it's just a silicone gel device that goes over the toe, and it has this stabilizing part at the bottom. which means it's not going to roll or turn around, and it holds, not only holds the toe down, but holds it stable, so it's not going to go, and you know, you've seen them go under and over other toes and that sort of thing. So this toe crutch has been very successful. I've really liked using it. I've used it on a number of patients now. This, in fact, this is one of my patients. I've just recently used it on. And I wanted to show you this case because I had to adjust it with this, and that's just real life. It fits most people. It comes in small, medium, and large. It also has these little inserts. They're tiny. They're about half an inch long. I know it's hard to tell in this picture. Firmer and softer, and they're squishy. And what you do is you can put them into that base part if you need little more support under there. I've been using it with the softer or with the, because a lot of my patients that I've used it on so far are sweet little ladies, and so I think that's why my choice of that. And you just yourself, you see this little hole here, you kind of wiggle these pads. It comes with both, and each pad you kind of wiggle it into there. It's really easy once you realize what to do. I had a learning curve with that part, but you can use it without that as well. Okay. Now, so this is the picture we saw, small, medium, and large. So this is a sweet, sweet gal, and you can see what the problem is. And that's before debridement and after. So she's had wounds there before, and I was nervous when I saw this, but I debrided it and it was fine underneath, in that it wasn't a wound. Here's a closer picture of, this is obviously not her foot, where you can see how it's kind of like a sled at the bottom that keeps it straight. So these are closer pictures, and from the bottom. So that's like a platform. All right. PediPlast has also been around for a long time. I've used it. It's Play-Doh. If you're old enough to know what Play-Doh was, it's great. It comes in a jar with an activator, and you take out the size of the amount. Here you go. The amount you think you might need, like the size of a teaspoon, or excuse me, tablespoon or something, and it shows you how much of the catalyst to use in there, and then you squeeze the two together and you kind of mold it and get it all mixed up so that the activator starts the hardening process. And then you can make anything you want out of it. So it's Arts and Crafts Day. This obviously is just like those crest pads, buttress pads that we just looked at, but this is going to be more personalized, and it's going to look something like this on the top. That's going to be the bottom of it. Let's see, do I have that picture? Yeah. It's going to fit up between the toes there. So it doesn't have a loop around the top, because having that all the way through the interspaces is going to hold it in place for all three of those. So you have to work with it. And because you have about, I better not say, I'm going to say a minute, 2 minutes. I better not say, because usually it doesn't take that long. You can make just an Interspace pad, like we had some of those with the kissing corns earlier. These, I imagine, are for specific sores or corns on the tops of toes or different areas. So you can do whatever you want with this, and it lasts forever. And because this doesn't have any straps or loops over the top, it also doesn't break. It literally lasts forever. So something like this is another option. And what we do a lot with this is for people who have trouble taking things in and out, or for unusual types of pathologies where they don't make an over-the-counter type of product. This, or several different pathologies together. They have kissing horns and bunions, or they, you see that all the time. So this is fun to work with, and it works really well. It's very professional, and it lasts forever. So the PediPlast is really something to consider. Oops, here's another one. So that would be keeping the some kind of interspace lesion from between the hallux and the second toe. So very versatile. All right, let's move on. Overlapping toes. We see those all day, don't we? What are we going to do with that? So we looked at this one already, and again, what? It has to be reducible for this one to work, but it works great. It's called a Boudin splint, 2 and 1. So I guess with this one, they probably could have done it with one, but there's different reasons. It's more stable. It doesn't turn, easier not to get on. There's lots of reasons. If it's reducible, this is a great pad. It also lasts forever. These loops are also adjustable. So I would see, you can see the pull tab right there. I would also do the same thing, get it adjusted and then super glue this tab underneath so it doesn't pull in some odd way. These are neat things. Most of the people I have wearing this are men. I'm not sure why, or if that's just my practice, but for these wraps, I don't know why. So you can kind of see there's different versions of it. It's hard to describe, so you'll just have to see, but they do the same thing. They're gonna overlap, they're gonna overlap the toes and kind of buddy splint them together. So whichever model or version you have, people turn to like one or the other, and they come 6 to a package. So they last a long time, but you know the way Velcro is. Well, it's not Velcro, but it's hook and loop and very fine mesh, by the way. So it's not at all something that rubs. Back to that boot and splint. This is another kind of silicone like these are that you can see would go between two toes, or they can take that overlapping toe with just the one that we looked at a minute ago. So lots of options for that all work. Why does some people like one versus another? It's just personal preference. Maybe it's easier to get on for them. Maybe it doesn't take up room in their shoe. Maybe, I don't know. But that's why you need to know different options for them, because overlapping toes can certainly be painful and can create enough rubbing that it can cause wounds as well. So lots of options to get those overlapping toes down. All right, bunions and arthritis. So not everything that's in the first metatarsal phalangeal joint, not everything that's there is a bunion. You know that, but your patients don't. Sometimes it's just arthritis. So regardless of whether the bump there is a bunion or degenerative changes, arthritis, there are some wonderful pads to keep it from rubbing because it gets painful. It can be painful just from the motion, and these will help a little bit with that too. But the thing you have to be careful of when you're getting devices like this is that the device itself is a high quality like these are, where it doesn't take up extra room in the shoe, because you can actually increase the pressure on that bony prominence if the device itself is thick. So stay with quality product. You can see this is thin, but it's certainly thick enough to prevent rubbing and chafing and bumping. So here would be, it's a loop around the great toe, and it's kind of held in place by the sock and the loop. Here, if they have the tailor's bunion, which is the same deformity, but on the lateral side of the foot at the 5th metatarsal phalangeal joint. So this is the same exact kind of pad. Here's just a different angle of it, you can see. Comes in a variation where you can have this spacer in there or a bit smaller spacer to keep the deviation, the lateral deviation of the hallux to a minimum. It kind of puts that back and prevents that overriding of the second toe. We've looked at pads like this, braces like this before, mostly on the lesser toes, where it's kind of buddy splinting it together with a little spacer in between. So that works really well. Now this isn't going to help the bunion area itself, excuse me, the prominence area, but this is going to keep the toes in better alignment. This is going to do both, just like these two. It's going to keep the toes in alignment and do some protection back there. This is like the first one in this row, but doesn't have the buddy connection to the second toe. It just is going to provide some, in fact, that's like the one I showed you that for my one patient where she had that sore right here. So this is, she doesn't have a bunion. What she has is an interspace or an interdigital pre-ulcerative lesion, a sore. So while this for a bunion would help that hallux move back into a more normal position, not permanently, but while they have it on, Only surgery fixes these things permanently, but this can relieve the pressure and therefore relieve the pain. And that's what we're about in conservative care. And then here's another Interspace brace or spacer to keep them apart if there were a sore spot, or if you just wanted to get the hallux back where it belongs during when the person is wearing it. It's all about relieving the pain and preventing the rubbing that can cause sores. These are sleeves, aperture cushions, so it has the gel inside of it, soft gel pad, so you can kind of see. And that's nice because it doesn't leave. It stays right where it is all day, and it doesn't take up too much room in the shoe either. Remember, that's an issue. These two, let's go over here first. We've all seen these. They're the self-adhesive felt pads. Make sure that the hole in this is big enough. So it's just felt, so I will often just stretch it and make that hole a little bit bigger because you want it to fit all the way over whatever the prominence is. If it only fits over a part of it, you're actually going to increase the pressure. So these are fabulous pads, but be sure to widen the hole if you have to. You just pull. You don't have to cut, just pull. I love these too. This sticks on there. This is sort of a satin material, and it takes up zero room in the shoe. This works great in women's dress shoes. That's what I have my patients using it for. It's very thin. It's gel that sticks, so it's not adhesive, and it's very, very flat. So it keeps the shoe rubbing or sliding rather than rubbing on the sole. And there's a little bit of gel, so it's not pushing, and you're not adding any additional material there that you don't have to, because in a woman's dress shoe, there's no room for that. So I love these. And you just wash it off, the gel on the inside, and it sticks again. So that is absolutely, you're not going to get this necessarily in a woman's dress shoe, but this you are. It's fabulous. So lots of these kind of devices, again, meant to realign the hallux from its medial lateral deviation, different ways that it does that. Now, does it do that permanently? None of these pads change anything permanently. You can wear it 24 hours a day for a year. It won't change anything permanently, but it relieves pain and makes walking a little easier, makes the aesthetics of it a little bit better. So this one too is used post-operatively, but even if the person isn't a surgical candidate or there's just not something's going to go to surgery right now, these can relieve the pain. I have mostly wearing it at night because this isn't going to fit in a shoe. But if for some reason the feet tend to hurt more at night, I think it's because the nerves, and you had endorphins during the day, lots of other things for your brain to be thinking about. And at night, if everything's quiet, the endorphins kind of go away. And feet tend to hurt more at night. And so that would be the time to give them some relief with something like this. So pressure from hammer toes in the shoe material. We've all seen that. People use their shoes, their feet as a shoe stretcher, right? What's really happening there? Oh, here's that plantar plate again, where if the plantar plate tears, now that can lift up. So instead of the toe being straight, because the plantar plate mechanism is holding it down, now that toe can come up. So that's one thing that can cause hammer toes. And we talked about the fact there are others. But so now that's tall. What happens? So when that's up in the air like that, and it's hitting the shoe on the top, the shoe is pushing down on that toe. Well, it's pushing down on two places. It's pushing down on the tip of the toe, but it's also pushing down on the longer part of the toe, the proximal phalanx, which is pushing down there. So you get two different sores, one under the metatarsal head and one under the metatarsal head and one under the toe. You don't always get both, but you see my point. So it's called retrograde pressure. The shoe pressure pushes down on it, but it pushes down this way too. So you can get either or both. Retrograde pressure because the hammer toe, the shoe presses on the hammer toe and it presses down and pushes those bones in. We saw these before, plantar forefoot protection, but these are adjusted a little bit differently. The other plantar forefoot protections we saw, protection sleeves that we saw, had the entire area with the gel inside. This, you can see by this outline, only has it where the outline is. So that lifts up the 3rd, 4th, and 5th metatarsals, which leads a little divot for that first metatarsal to kind of fall into. So that would be helpful. We can do that with felt in the shoe, or we can do it in an orthotic. You've seen that. Or the person can wear something like this. So there's many different ways we can take pressure off the plantar surface of that first metatarsal phalangeal joint. And this is one of them. Various pads to relieve plantar forefoot pressure. So we saw different types. These are all reusable. The ones on this side are that special gel material that's self-adherent. And you can see the placement for them. So instead of a felt pad under there, here would be maybe your metatarsal head. You can use this. All of these, you just wash them with soap in the sink and dry them, and they stick again if they get skin cells and things on them. So they last a long time. Dancer's pad, but it's that same thing. I think this picture shows it off a little bit. It should be moved over a little bit because here is where that hole should be. That's like the pad we saw in the previous slide where there was no padding under where the first metatarsal was, so that the first metatarsal had a place to go, and it had like a divot there. So you can see some of these. This one might be good on the ball of the foot, and again, the picture, I would move it forward a little bit, not too much because it doesn't go over that hump well, but a little bit further. Although it's hard when the patient's doing it themselves. A lot of times in the seniors, their fat pad in the plantar foot disseminates, it goes away. So they're literally walking on bones, even if their toes are straight. So they're maybe not getting calluses because of this, but they may be getting calluses or just a lot of pain because there's no padding there, and their bones are, all 5 metatarsal heads are hitting on the floor because their fat pad has shrunk away or moved away. So something like this that goes around the entire area of the metatarsal heads would be fabulous for that. These are more the felt, self-adhesive felt versions of some of those. Now here again, remember they're just felt, pull those holes so they're big enough to go totally over the sore. You don't want it half and half, so wiggle them until they go over, or use the U-shaped pads like this. Then you don't have that problem. Okay, here's now this is just as thick as moleskin, so this is more for rubbing, but it can help a little bit if they have lost their fat pad. These are more for things like Morton's neuroma and that sort of thing that you'll know about to push up the metatarsal heads, and we haven't talked about that. But lots of these. So these are self-adherent. I find, by the way, that the patient can wear these through showers. I've never had a problem. There's a really good adhesive on it, and it blocks the moisture from getting to the skin underneath. So I let them wear them in a shower. I just say, please then stand on a towel, not just your bath rug, those are usually nylon of some kind. Stand on your towel and kind of get the fluid, water out of it, and don't put your socks on right away to let it dry out. But even if it doesn't, because who knows what they're going to do. I've never had it cause maceration, which is the white skin damage that you get from too much moisture. So the felt ones that are self-adhesive, it's okay if they wear them in the shower. They'll last for 2 or 3 days if they do that carefully. So they might need to wear a sock to bed to keep it on, that kind of thing. They can use Band-Aids to hold some of them on, but please have them wear the fabric Band-Aids, not the plastic Band-Aids, because the plastic Band-Aids don't breathe, and I do find some maceration under those. So use the fabric Band-Aids, it's easy to find, and different shapes and sizes. That way the Band-Aid can breathe and the pad can dry out. Love it. All right, various pads. So in your shoe itself, here's some silicone gel step. And you know that we don't have to always have everything full length. And sometimes there's just not room in the shoe for that. And usually, other than a few exceptions, you don't need padding under the toes. You need it just to the sulcus area. And the gel, the blue gel in there has is softer, a lower durometer. It's softer, so provide some padding in that way. Now, having said that, this one wouldn't be good for metatarsalgia, would it? Because it stops back here. So if metatarsalgia was what you were doing, you would need a full-length one, or you would need one of these. But these are good for some of the other types of pain that you can have, heel pain, and just proximal to the metatarsal head area. And finally, these are brand new. For a long time, we've had the big Velcro-on knee-high boots that we use for different things, and they've had these pull-out plug systems. But in those boots, there's too much movement in the boot. But now they're being made thin enough and appropriate to go into regular shoes, not dress shoes, but most athletic shoes. You would take out the insert that's there and put this in. And you can adjust them specifically for that person. So maybe under, I'm guessing, the first metatarsal head and the fourth, or it's probably the fourth metatarsal head, maybe there's a pain under the heel. You take out these little plugs that are there and you create your own divots, and it just works really well. They come in different layers. So a stabilizer, that's a base layer, because you don't want that necessarily right against your shoe. It needs to be more stabilized than that. So that would go in the shoe. You've taken the other insert out that the shoe came with. Put the base unit in, and then you've adjusted this to the areas that need the pressure relief. Then put it in, and there's often a top layer as well. And it's usually this plastizote material, also called poron. Oh, sorry, poron is the blue, is the light blue. So there's different materials they're making out of it. So the top and the bottom, and then this is in, the peg part is in between. And, okay, removable plantar plugs unload targeted areas, offload sore spots to relieve pain and reduce friction, minimize skin breakdown due to repetitive microtrauma, distribute pressure away from sensitive areas, and prevent, relieve, and heal. It's amazing that now you can get these and customize them to go in a shoe that will hold them in place, as opposed to the big knee-high walkers that we used to give them. They A, didn't wear them as often because they were knee-high walkers. Nobody likes those. And B, their foot would move too much in it. So this can go in an extra depth shoe if they have those, and that's a common thing. Or if it's a well-fitting and spacious athletic shoe. You can get versions that'll go into that. That's a more permanent thing. They would have this in their shoe, and some people can't afford to or don't have access to pet orthics or orthotists where they can make some of these kind of things. Your office may not make these sort of accommodative orthotics. They may make more dress or sport orthotics. So there's a real place for this, and certainly in my wound care practice, we would use this quite a bit. All right. Well, we've gone through quite a bit. We tried to cover several different common deformities, talk about what's causing them, what you can do about them, some of the pitfalls of it. It's so fun working with the patients and getting them something like these devices and pads that can relieve pressure and pain and let them lead happier lives and more active lives. So I hope this has been helpful in introducing you to some of them. Please try them out, and I think you're going to see the patients are very appreciative. So thanks a lot. Take care and go out there and get those feet better. Thank you. Bye-bye.